Queensland reported some significant issues in their hotel quarantine arrangements. We wish our friends in Brisbane and Queensland well, and we thank them for the positive partnership that we have at a public health level, officials as well as at a minister-to-minister level. I've had a number of texts back and forth with Premier Palaszczuk about these issues. As a result of yesterday's developments, our advice to people that have returned from Queensland red zones since the 30th of December has changed. We have about 18, was 20, and then 2 have gone on to South Australia. So we have 18 people who were in hotel quarantine during the relevant period. We are contacting them, we are testing them. Some will need to isolate, some will simply need to get a negative test. It's very difficult to, there's not one blanket answer. It depends on when they were in hotel quarantine. There's a specific window where we believe there is some chance that because of the infections that have already been recorded in hotel quarantine between staff and residents, and it is that UK strain without any other link, circumstances are very much based on each person's travel movements and when they were in hotel quarantine. So I can't tell you, it's not a blanket thing for all 18, it'll depend on their individual circumstances, but we're well and truly in contact with them and we'll provide them with tailored and specific advice about what they need to do, and we thank them in advance for the cooperation that they will no doubt provide to us, and indeed their close contacts, people that they have returned home to in these last few days. Those 18 people, when we have a further update to provide you, we will, but there's a lot of work. Our contact tracing team worked throughout the night last night, and we'll continue to support and advise those people, and can I say as well, to check that they are compliant with whatever requests we make of them. I won't necessarily go into any more detail about Queensland. We'll let the Queensland Government update you on where things are at up there, but obviously that's a pretty serious set of circumstances. We're taking it very seriously. To have 18 people who could be infected with that novel strain, that highly infectious strain out of the UK, is a concern to us. That's why we have settings for the Brisbane red zones as determined by National Cabinet and as announced by the Prime Minister last Friday. But those 18 people are being followed up, and I want to reassure every Victorian that we are working diligently, and our public health team are doing a great job to support, but also to advise those people to minimise any risk of further transmission here in Victoria. In terms of a couple of positive things that I can confirm, given 8 days of zero, and I don't think anybody should underestimate just how significant an achievement by our public health team and our Victorian community to have the Black Rock cluster, to have the mystery case as we've out of Vermont South, and then to do massive amounts of testing, absolute top-rate contact tracing, elite-level contact tracing, and to pull this up and then produce 8 days of zero is something that all of our public health team can be proud of. I'm proud of them, and I'm proud of Victorians for playing their part in doing that. Doesn't mean that tomorrow there mightn't be a case. It doesn't mean that we should ever take for granted the precious thing that we've built. That's why we've had to make very difficult decisions in relation to people that are in the New South Wales red zone. That's why we've put in place a permit system, and if anyone needed any proof of how important a permit system is, then if it had been just a few days later, the Queensland example, the Brisbane hotel quarantine example, permits would have made the job of contact tracers last night and indeed today much easier, because we would have permits for all of those people. Some of them had in fact returned home before there was a classification in Brisbane and before, of course, we'd rolled out our permit system. To get to this 8 days in a row of zero is no small thing, and it's a credit to all of our public health team and a credit to all Victorians who've played their part in doing so. However, with those 8 days and with some the sort of stability in our numbers that we want to see, I can confirm that on Monday, private sector businesses will be able to go to 50% working from the office, and public sector will go to 25%. As you know, we have kept the public sector back a bit to enable greater capacity in the private sector. This is really important. It won't mean every worker, obviously it's 50%, but it's a positive step forward. I think pausing for the week was the right choice to make, given there was some uncertainty, but now 8 days of zero means we can make that announcement That gives some notice. I'm sure people would always like more notice rather than less, but that decision was only made this morning by our public health team. So I can confirm that. I can also confirm that we will revert back to the mask wearing protocols that again from 11:59 p.m. this Sunday, the 17th. So from Monday, the 18th, we'll revert back to the Christmas mask settings. So everyone would remember, because people have been very compliant and been doing a great job. We moved from not just shopping centres, supermarkets, public transport, those sorts of environments where you would wear a mask or where you couldn't maintain 1.5 metres. We moved to all indoor settings. We will go back to just those higher risk settings, if you like. So if you're going to Chadstone, if you're going to Coles, Woolworths, Aldi, those sorts of settings, the people are very well aware of basically the Christmas settings rather than the New Year settings. There'll be advice on our website just to reconfirm and update everybody in case they need any guidance. But we know that masks have been a very important insurance policy. When you think about a person who we believe was infectious or may well have contracted the virus, it's uncertain, that's the nature of a mystery case. But there are many different examples. Out Boxing Day sales, out and about, moving throughout the community, in large areas where large numbers of people gather, people that are not necessarily known to you. Masks do serve a very important purpose, and that is that extra layer, that extra level of protection against transmitting this virus. It is a small impost. I know no one enjoys wearing a mask, particularly at this time of year, but at the same time, the inconvenience of wearing a mask in those, from Monday, those pre-New Year's settings. So when you're out grocery shopping, when you're in an indoor environment like the ones we've listed, then it just makes sense. The inconvenience of that is but a fraction of all the difficulty and the challenge that we face if we have extra cases. And particularly...
OK, so we'll leave the Victorian Premier there. The two big announcements: office workers returning back to the CBD on Monday, and indoor mask rules will change back to the pre-Christmas setting.